Today we are going to learn about osteogenesis imperfecta. It is also known as brittle bones, osteoarthritis, and Lobster disease. Coming to the introduction part, it is an heterogeneous group of genetic diseases with a predominant autosomal dominant pattern of inheritance. Coming to the etiology, mainly it is by the abnormal type 1 collagen formation. This type 1 collagen formation is there in bone, sclera, fascia, tendon, dentine, and skin. So the gene coding for this type 1 collagen are mainly two genes. One is the COL1A1 gene, which is present on chromosome 17q21, and another one is the COL1A2, which is present on 17q22. So there is a mutation of these both genes which causes the incomplete or abnormal transformation of the fetal collagen to the mature collagen. Basically, failure of the transformation of this fetal collagen to the mature collagen, which causes increased tendency of fracture and delayed bone healing. Coming to the clinical features, age of onset, it varies. It often is in the stillborn or the affected babies die shortly after the birth. There is no known sex predilection observed. Coming to the main characteristic features, it has an extreme fragility and porosity of bones, which has an increased tendency of fracture. Second characteristic feature is the pale blue sclera, which is abnormally thin. Then there is also hearing loss due to osteosclerosis, which leads to the compression of nerves and laxity of ligament, leading to hypermobility of the joints. Now, coming to the types of osteogenesis imperfecta. In Schaeffer's, they have given a beautiful table on that, which has basically 4 types of osteogenesis imperfecta, and they have divided it into the inheritance, severity, congenital fractures, everything. They have given everything in detail, which we can write in the exam. It has inheritance, severity, congenital fracture, and joint hypermobility, hearing loss, all the clinical features of the 4 types. Then, coming to the oral manifestations, there is basically disturbance of the mesodermal tissues here, which is disturbance in the dentine formation. This is also called as opalescent dentine, which differs from dentinogenesis imperfecta. There is also greater chance of class 3 malocclusion, and there is frequent anterior and posterior crossbite and open bites present. There is also a large number of ectopic tooth and impactions are seen in these patients. Coming to the radiographic feature, it has systemically and orally. Systemically, we have the osteopenia, there is bowing of bone, there are multiple fractures, and Womerian bone, which are multiple small sutural bones which fail to fuse. Orally, we can see multiple radio opacities and radiolucencies in the jawbone in panoramic radiograph. And in periapical radiograph, there is premature pulpal obliteration of the affected teeth. Then, coming to the histologic features, it is subdivided as this. The bone with osteogenesis imperfecta has thin cortices, which has immature spongy bone, and trabeculae of cancellous bone with microfracture. The osteoblastic activity is also retarded and imperfect. The collagen, the organic matrix of collagen, defects in the transformation of fetal collagen to the mature collagen, as we know. Then there are two qualities, qualitative and quantitative. Qualitative is the abnormal collagen 1 molecule formation, and quantitative is the decreased production of normal collagen 1 molecule. Then calcification is normal. Coming to the treatment, the prenatal ultrasonography is necessary for the early diagnosis of prenatal fractures. It is helpful. Then the diagnosis can be confirmed by the chorion list biopsy, and or either it can be done by the culture of chorionic villi cells, which demonstrate the abnormal collagen type 1, and then by the DNA for the molecular analysis of genes involved. Management is done by genetic counseling. If there are any infections, then treatment is done for those infections. Other than that, no medical therapy is involved. The prognosis varies from good to very poor.